How do doctors diagnose inflammatory bowel disease in the colon? Have you ever wondered how doctors figure out if someone has inflammatory bowel disease? This condition includes ulcerative colitis and Crohn's disease, which can affect the colon and other parts of the gastrointestinal tract. The process of diagnosing inflammatory bowel disease is quite thorough and involves several steps. First, it all starts with a clinical evaluation. The doctor will take a detailed medical history and perform a physical examination. Patients often report symptoms like persistent diarrhea, abdominal pain, weight loss, and rectal bleeding. These symptoms are vital clues that can lead healthcare providers to suspect inflammatory bowel disease and prompt further testing. Next, imaging tests play a significant role. Doctors may use X-rays, computed tomography scans, or magnetic resonance imaging scans to look for complications like strictures or fistulas. These tests help assess how much of the gastrointestinal tract is affected, especially in cases of Crohn's disease, where the small intestine is often involved. Endoscopic procedures are crucial for a definitive diagnosis. A common procedure is a colonoscopy, where a flexible tube with a camera is inserted into the colon. This allows the doctor to visually inspect the mucosa for signs of inflammation, ulcers, or other abnormalities. During this procedure, biopsies can be taken to confirm the diagnosis. There is also sigmoidoscopy, which focuses on the sigmoid colon and rectum. While it is less comprehensive than a colonoscopy, it can still be helpful for monitoring disease activity in the lower parts of the colon. After obtaining biopsy samples, a histological examination is performed. The samples are examined under a microscope to look for specific changes associated with inflammatory bowel disease, such as chronic inflammation, ulcers, or granulomas. This step is essential for distinguishing between different types of inflammatory bowel disease and other similar conditions. Blood and stool tests are also part of the diagnostic process. Blood tests may show signs of inflammation, such as elevated levels of C-reactive protein or erythrocyte sedimentation rate, and can indicate anemia due to chronic blood loss. Stool tests help rule out infections that could mimic the symptoms of inflammatory bowel disease. For patients who have undergone certain surgical procedures, scoring systems like the Pouchitis Disease Activity Index may be used to assess disease activity based on clinical, endoscopic, and histological criteria. In summary, diagnosing inflammatory bowel disease in the colon involves a comprehensive approach that includes clinical assessment, imaging tests, endoscopy, and histological examination. Each of these steps is crucial for accurately identifying the condition and guiding appropriate treatment. If you suspect you have symptoms of inflammatory bowel disease, it is always best to consult with a healthcare professional for personalized advice and care.